I'm Dana Denha, and you're watching FYI. November is Pancreatic Cancer Awareness Month, and the Detroit affiliate of the Pancreatic Cancer Action Network, PanCAN, is urging residents to demand better for patients and for survival for the world's toughest cancer by knowing the signs, symptoms, and risk factors. Pancreatic cancer is the third leading cause of cancer-related death in the U.S., with a 5-year survival rate of just 9%. And to make matters worse, 71% of patients do not survive the first year of diagnosis. And the key to early detection is knowing the symptoms and risks for pancreatic cancer. Joining me is Monica-Amit Mishra, Advocacy Chair for the PanCAN Detroit affiliate, Meghan Combs, Donor and Corporate Ambassador for the PanCAN Detroit affiliate, and Dr. Howard Crawford, PanCAN Scientific and Medical Advisory Board and Professor of Molecular and Integrative Physiology and Internal Medicine at the University of Michigan. Welcome to the show.
Thank you for having us.
So, Dr. Howard Crawford, why don't you fill us in on what pancreatic cancer is and maybe what we should be looking for when we're not feeling so well?
Well, pancreatic cancer has very nonspecific symptoms, and I don't want to scare people in your audience because everyone, when they hear this, they're going to think, oh, I've got pancreatic cancer. Most likely not true. If you have back pain that's unexpected, if you have jaundice, that is your face and your eyes turn a little bit yellow, you may have pancreatic cancer. The signs that we really look for now, particularly, is if you have unexpected weight loss or you have late onset diabetes, and particularly those two together. You get diabetes when you're older, maybe about after 60, accompanied with weight loss. That's very unusual. Usually people get diabetes when they put on a lot of weight. So that combination is something that we should definitely be paying attention to. Why is it so bad? It's very difficult to see the pancreas. It's very centrally located in our body. We can't just put a scope into it and see, as a preventative screen like we can for colon and breast cancer. So it's a tough cancer to crack. Plus, not many people get it. That's the good news. So it's one of the last things we would think to diagnose given those nonspecific symptoms.
So the big one is the diabetes, weight loss. That's like a huge notification.
It is definitely something that you should pay attention to and then bring up with your doctor. A lot of people get diagnosed with diabetes, but they don't mention potentially the weight loss if they haven't seen their doctor over a long period of time. And more recently, it might not be caught. They have to report it themselves. You have to be your own advocate in these cases. You have to say something's not right, something's unusual, and see your doctor and get diagnosed.
So can you explain, you guys are all involved with PanCAN, but can you explain what it is? Meghan?
Well, PanCAN stands for Pancreatic Cancer Action Network. It's been in existence since, I think, 1999. A woman started it who's lost her mother to the disease and realized there was really no big advocacy movement or organization that was addressing the need for this disease. So Pam started the organization, and it's grown by leaps and bounds. And it really covers everything from research, giving money to researchers, advocacy in DC to try to get more funding, and then patient and caregiver support. So those are really the things that PanCAN, or Pancreatic Cancer Action Network, offers. It's very extensive in what it provides, and it's a wonderful organization.
Well, if both of you have your own individual personal stories with pancreatic cancer, if you could kind of tell me about it and why you got involved with PanCAN.
Yeah, I lost my mom about 9 years ago. This past week was her 9-year anniversary to when we lost her. And she had vague symptoms, like Dr. Crawford mentioned, just not feeling well in general, a little bit of weight loss. And she went to urgent care, found out she had a little jaundice, which we didn't even notice. And within a few days, we knew that she had inoperable pancreatic cancer. She lived a year, and I just was stunned that there was a disease that felt that hopeless at the time. So that's what got me involved. That's what prompted me to get involved with the affiliate in Detroit, and it's been a great experience, both very therapeutic in meeting other people who've been touched by it, but also just seeing the great progress that we've made.
Well, and you were a donor too. What does that entail?
My volunteer role is donor corporate ambassador. So what I do is I work with sponsors and donors and teams for some of the events that we have. So people that want to be a sponsor and donate money and support our Purple Stride Walk every year, or Purple Light, I work with those folks locally here in Michigan.
Okay. So, Monica, why don't you tell us about your story?
2002, my mother was diagnosed with pancreatic cancer, and the doctor was pretty blunt about the fact that there was nothing that the medical world had to offer, and it was like a blow. And after she passed on, I knew I had to get involved somehow. I just didn't know how or where. And I did some research and found Pancreatic Cancer Action Network. The word action kind of really resonated with me because I wanted to get involved in it. And I really liked the multiple faceted way Pancreatic Cancer Action Network was confronting or addressing the issue of pancreatic cancer. Advocacy, as Meghan mentioned, research, clinical trials, so since I wanted to do something on the ground, this was something that really appealed to me right away. And I'm glad I did join the Pancreatic Cancer Action Network. 2 years ago, my father was diagnosed, and he passed on a year later. This is indeed the world's toughest disease, and I'm glad that I'm involved, and I am planning to stay involved that way as an advocate. That's what I do. I'm the advocacy chair for the Detroit affiliate, and every year I go to DC and raise awareness and talk to our senators and House representatives and things like that.
Are you doing other things at the local level to get just like the average person involved?
Absolutely. November 16th, the Washtenaw County just issued a proclamation saying, thank you, Board of Commissioners of Washtenaw County and Pittsfield Charter Township. They both issued a proclamation declaring November 16th as World Pancreatic Cancer Day. I am always seen wearing purple, which is the color of hope and fight for pancreatic cancer. So anytime people ask me, well, why are you wearing purple? I start a dialogue and try to educate them, let them know about the symptoms. I volunteer from time to time at the hospital, given an opportunity. I like to interact with people. Any opportunity that I get besides being an advocate in the sense that, taking action alerts and contacting our elected officials, letting the masses know that 80% of our research funding comes from the federal government, and the importance that a regular person can play in changing the landscape of this disease is huge. When I tell that to people, most people are not even aware of that. And so that's what I do at the local level, on Facebook, social media.
Why don't you expand on you mentioned the purple stride and the purple light, but I don't think people know what that is.
Yeah, thank you. So for people that want to get involved locally, we do quite a bit in the Ann Arbor area. We've hosted meetings before where we've had speakers come in. We have a large walk once a year called Purple Stride. It's the walk to end pancreatic cancer. And we have teams from all over the state, from this area, from the west side of the state, all over, and even people out of state. It's usually held in the Detroit area somewhere. We don't have a date set yet for next year's, but as soon as we do, we'll let you know. But people can follow us on Facebook and get all the latest news. Detroit affiliate, Pancreatic Cancer Action Network would be what they would look for there. But we do a large walk. We raise hundreds of thousands of dollars just in Michigan. We have thousands of people come to walk, and it's a great way for folks to honor a loved one or a family member or friend who's battling the disease. So we have a lot of teams that come. And then we also do Purple Light. It's a vigil. We just had it in October. And it's a way, again, to honor those battling and those that have lost the battle to the disease. So we do those two large events, and then we also are present at local health fairs and things like that to continue to raise awareness. But like Monica said, there's things you can do locally as far as get on our email list and you'll be sent an action alert where you simply, type in your zip code and send a message to your congressperson.
And let our Congress members know, our elected officials know that cancer research is a national priority. So it is something that does not require a lot of time. It's a pre-written letter, and just enter your zip code and off the message goes. And the more our Congress members hear from us, the more they're going to fund the disease. which will result in more people coming and doing research on pancreatic cancer, and we already have a brilliant mentor and scientist here with us, and we'll have many more. That's what I do locally and on a national level. The best way to get more information is to go to pancan.org.
Okay.
Or if there is anybody who has been diagnosed with this disease, they can go to 8772-PANCAN.
Okay. And
to
it
get more
sounds like
information.
it's important to be an advocate for pancreatic cancer survivors and victims, even if you don't know somebody, because, like you mentioned, the survival rate isn't great, but not a ton of people are diagnosed
Right.
with it, which
Right.
is the plus to it.
Yeah, that's the one plus.
Yeah.
But we don't really have a lot of survivors, and because we don't have a lot of survivors, those voices don't get raised.
Yes.
So it has to be coming from the friends, the family, and if you're a friend of a friend of a friend,
Yeah.
to actually get out there and be involved. Very important messages that have to be put forward is that in order for us to increase the survival rate for this, we don't have to just do research, we actually have to do education. So people will get in touch with pancan.org, will go onto their patient registry or their caregivers registry. They will connect patients and caregivers with clinical trials, which there's just not enough people doing clinical trials. The only way we're going to make progress is for people to join clinical trials, and with so few patients available, we need almost all of them to go in and join clinical trials when they're eligible for them. So it's very important that they get in touch with someplace like PanCan. I would say just PanCan. But
Yeah. So have you seen, or have you made any strides with anything recently with maybe being able to help people that have been diagnosed?
Well, so it's a very tough disease to work with. So what the progress that's coming right now comes from clinical trials that are being better designed, using often very classical chemotherapeutic regimens. So while we had one for a while that was not working very well, we've tested new ones, and they're actually pushing the needle forward on survival rates. Now what we're looking at is the ways to make those chemical chemotherapeutic agents even more effective. There are great researchers that are looking at how to make the tumor more accessible to the bloodstream so that when you put in a chemotherapeutic agent, it actually gets to the cancer and kills the cancer. That looks like it's going to have a lot of promise towards making pancreatic cancer just as bad as all the other cancers. So the idea that we can make this not such an anomalous disease and that we can begin to treat it. What's coming on the horizon, I think, is immunotherapy. That's to train your person's immune system to attack the cancer within them so that it can't hide anywhere within the body where the chemotherapy can't get to them. And so we at the University of Michigan and a coalition of many other universities and research centers are joined into a consortium to make immunotherapy more effective or at all effective for pancreatic cancer. It's been amazing against things like melanoma. So we know the promise is there if we could just make the therapies that exist more effective.
And are there certain lifestyle factors that contribute to people getting pancreatic cancer, genetics, age, or a diet, anything like that?
Yeah, so very, very minor ones, but they all add up. So the combination of these things, Western diet's always been bad for all the cancers we're talking about. So that is high sugar, high fat diets, smoking, a family history of having 2 or more first-degree relatives with pancreatic cancer having been diagnosed. You need to get on a genetic registry if that happens, so we can look and see if you have some of the mutations that do cause familial pancreatic cancer. Only about 10% of pancreatic cancer patients have familial disease. But when they do, we know how to treat that a lot better than we know how to treat the non-familial forms, the sporadic forms. So if you have a history, if your family has a history of melanoma, there's a mutation that's associated with that gives you risk for pancreatic cancer, especially if you have BRCA1, BRCA2, PALB2 mutations that give you a history or give you a risk for breast cancer. You need to be screened as much as possible for pancreatic cancer. If we know we should be looking at you, we have a much better chance of catching the disease early. Okay. We don't have great early detection systems. I think they're coming, but we have to know who to look at. When we do have them online, we have to make sure we are looking at the patients that are at high risk. And those are the people that are really going to benefit from those new techniques.
Okay, well, we're just about out of time, so if each one of you maybe wanted to add something about why donate, why support, why be an advocate?
Well, I would say before my mom was diagnosed, I did not know what pancreatic cancer was. I didn't know how kind of doom and gloom it was. And that's why I'm involved, and that's why I stay involved, and that's why we've gone from a 5% survival rate to a 9% survival rate. So I would encourage everybody could be impacted by this disease, and that's why it's important to donate to our walk, get involved, do an action alert, any of those things, because it can really affect any of us. Nobody's really safe from the disease. So,
what I'd like to say is the helplessness and the hopelessness that I felt when my mother was given practically the death sentence. And when my father called from India and told me that she has pancreatic cancer and the doctor says there's absolutely nothing we can do, the feeling that I went through, that I still go through, I wouldn't want anybody to go through that. And hence, I've made it my mission to be involved, stay involved, and help as much as I can.
And if you take that theme that Monica's bringing up, I want to emphasize, if you are diagnosed with pancreatic cancer and someone tells you there's nothing we can do, go get your affairs in order. You need to get a second opinion. You need to go to the nearest academic medical center, like the University of Michigan, and get that second opinion, because there usually is something that can be done. They're not always effective, but maybe they can get you into a clinical trial. Maybe you can help the next person that gets pancreatic cancer. So don't take no for an answer.
All right, well, thank you all for coming on the show and filling me in on this devastating cancer.
Happy to do it.
thank you for having
Thank you
us.
for having us.
Visit a2gov.org/watchctn for more on this and other programs. Thanks for watching, and tune in next time to FYI.